Okay, guys. So we're gonna do chapter six. I've remade this video two or three times. Most of you were in class, which helps. So we should be able to move through it pretty quick. Um, so we're gonna get started here. So the anatomy and physiology. We know anatomy. Human anatomy refers to the study of organs and body structure, such as bones, muscles, nerves, and form a system of specific functions. Uh, Physiology refers to the study of diseases. Pathophysiology is the study of abnormal changes in the body functions. We just talked about that. So, kind of what we talked about, topographic anatomy applies to the body in the anatomical position. That's where we're standing, facing arms to the side, hands or palms facing outward. Anytime we refer to a patient's condition or location on the body, we use the anatomical position. And then we've got those imaginary straight lines that divide the body into pieces. So we've got our frontal plane, which divides that body front to back. Our lateral plane divides the body left to right, and then our midline plane divides the body equally left and right halves. Um, we've got the transverse or axial plane divides the body top to bottom. This picture kind of demonstrates those. Cells. So our entire body is made up of cells. So the cell foundation of the human body. So tissues are cells that share a common function. And then we move on to an organ, which is a group of tissue, remind you, is made up of cells that perform similar or uh, interrelated jobs. And then we've got the body systems, which are organs from similar function working to of a similar function working together. So everything is made up of cell. It all starts with a cell. The skeleton. So we kind of break this down in two ways. We've got our axial skeleton and our appendicular skeleton. And it says pelvis, but the pelvis kind of plays in there with that appendicular skeleton. Um, So our axial skeleton is our head, neck, back, ribs, thoracic cavity, our spinal cord. Anything that goes in a straight line down the center, that's going to be our axial, and then our appendicular is our shoulder girdles, our upper extremities, lower extremities, and the pelvis. So the axial skeleton is the foundation to which the arms and legs are attached. This includes the skull, the facial bones, thoracic cage, and the vertebrae column. And then you get joints, and joints occur when bones come in contact at a meeting point. It consists of the ends of the bones and connects and supports tissue. Two types of joints. We got the ball socket joint, which allows for rotation and bending. Just think of a ball, you can move multiple directions. And then you've got your hinge joint, which is just two directions, like the hinge of a door. There's kind of a picture to help you visualize it. So our shoulder would be an example of that ball socket joint, where our elbow or our knee would be a good example of um, the hinge joint. Also, we've got our skull. So our cranium is made up of four bones, and then our face is actually made up of 14 bones. You can kind of look over this. The main ones are your maxilla and your mandible, um, frontal bone. One that you really need to remember, because I know it's on test questions, that's when I say that, is going to be right here. Your foramen magnum and your occipital bone. You might see these on test questions. Moving on to the spinal column, you got 33 bones in the vertebrae divided into five sections. So you've got your cervical, your thoracic, your lumbar, your sacrum, and your coccyx. That's from top to bottom. Remember, it is 7, 12, 5, 5, 4. So 7 cervicals from the base of the skull down here to where your thoracic begins. Your thoracic has 12 vertebrae down to your lumbar. Lumbar has 5. And then we go sacrum, 5. And your coccyx is 4. But these are fused together. Your thorax, it formed by 12 thoracic vertebrae and 12 pairs of ribs. Your thoracic cavity contains your heart, lungs, esophagus, and great vessels. The main job of this is to protect your organs and great vessels. Then we move on to that appendicular skeleton. This is going to be your arms, legs, their connective points, so those joints, and pelvises. So your joints, upper extremities, pelvis, lower extremities. So your upper extremities extend from the pectoral girdle to the fingertips. They compose of arms, forearms, hands, and fingers. Your shoulder girdle has 3 major components. That's going to be your clavicle, which is located in the front. Your scapula, which is back here, this triangle shape, that's located there in the back. And then your humerus, which is the main support of your arm. That's the main support bone. So your arm is your humerus, is the supporting bone. Forearm consists of the radius and ulna. The radius on the lateral side, ulna is on the medial side. Our wrist and hand, so it's a ball and socket joint. It's got carpals, metacarpals, and phalanges. So these carpals, remember, there's a whole bunch of little bitty bones in here, and then our metacarpals are these. Then our phalanges finally are our actual fingers that extend out. The pelvis girdle, it consists of 2 coccyx or hip bones, your sacrum and your coccyx. Each pelvis bone is formed by fusing the ilium, the ischium, and the pubis. Um, so our fusing points are right here. We've kind of talked about this in class. I don't want to waste a lot of time on it. Anytime we have injury to the pelvis, we need to take it extremely serious. So our femur, it kind of sets on its own. It's kind of yes, it's part of the leg, but it's the upper leg. It's not the main focus though, and it's hard to explain. The longest bone in the body is your femur. It connects at the pelvic girdle. It's a ball socket joint. The greater and lesser trochanter are where the major muscles and thigh connect to the femur. So knee is connected to the upper leg and to the lower leg, the kneecap. It's called the patella. Your lower leg is your tibia and fibia. So your shin bone, anterior of the leg, and your fibia is lateral side of the leg. Lower extremity is ankle. It's their hinge joint and allows flexion extension of the foot. So I'm going to go back just a minute. So just remember, your femur is not considered in the actual definition of your leg bones. Femur sets by itself, so your tibia fibia make up your leg bone. Let's see. The foot, it contains 7 tarsal bones, 5 metatarsal bones, and it is the substance of the foot. The toes are formed by phalanges. So the skeletal system, what's it do? It gives your body its shape, protects fatigue or fragile organs, allows for movement, stores calcium, and helps create blood cells. Musculoskeletal system. So now we're into the muscles. It gives us our form, our upright posture, our movement, and protects vital organs. So there's 3 types of muscles. The skeletal muscle or voluntary muscle. These are the ones that we can actually kind of control when we think about it. we want to take a step or we want to move our arm, we're using these voluntary or skeletal muscles. Smooth muscles, these are what you're going to find like in your abdomen, like in your digestive system. They are naturally moving food through the process of our digestive system without us doing it. We have no control over it. And then you've got cardiac muscle. Cardiac muscle is exactly what it sounds like, the heart. The heart is the only thing in the body that has cardiac muscle. Some of your basic everyday muscles that are good to know, like your deltoids, your trapezoids, pectoral major, your biceps, your quads, gluteus maximus, um, very basic on the muscle side of things, what we really need to know. Let's see. Contraction and relaxation of the system makes it possible to move and manipulate the environment. Every time we move these muscles, we're producing heat. It is a byproduct of that move or of muscles moving. And then another function of the muscles is to protect structures under them. Moving on to the respiratory system. So, anatomy, structure of the body that contributes to the respiratory, the process of breathing. Um, as we go on into our respiratory chapters, we'll go deeper into this, but your upper airway and your lower airway, and then down through your bronchioles, bronchi, into our alveoli, where uh, oxygen is moved into the bloodstream and is cycled back to the heart and to the body. So our upper airways is going to be our nose, our mouth, our tongue, our jaw, our larynx, and it's divided upper and lower airway. Upper airway also has your pharynx, your nasopharynx, oropharynx, and laryngopharynx, your trachea, and your epiglottis. Your lower airway, that's going to be thyroid cartilage or your Adam's apple. It's the most pronounced spot on the neck or throat. Um, Cricoid cartilage, which is immediate below the thyroid cartilage, and the cricoid membrane. Your trachea, which is going to go down and it ends at the carina, which is that dividing into the left and right lung. Your lungs, there are two lungs. They're held in place by your trachea, arteries and veins, and the pulmonary ligaments. It divides into two. So you've got your left lung, right lung. Your left lung has two lobes. Your right lung has three lobes. And that's due to your heart being more to the left. So there's only two lobes on that left side. Within the lobes are bronchi, bronchioles, and alveoli, and it allows for gas exchange at that alveoli capillary bed area. You also have the pleura, a layer of smooth, glistening tissue that covers each lung and lines the chest cavity. Between the two layers, like the lung and the pleura, is a fluid which allows it for smooth gliding. So we don't get just rubbing up against each other. So when them lungs expand, they have some kind of lubrication to assist in that nice smooth movement. Let's see. This is still talking about lungs, thyroid cartilage, cricoid cartilage, trachea, also known as the windpipe. Your alveoli are at the base of those bronchi or bronchioles. Then we've got our diaphragm. It's the primary muscle for breathing. Also involved are your neck, like your clavicle muscles, your intercostal muscles, your abdominal muscles, and your pectoral muscles. If people are breathing and they're using these things, like if you notice that the clavicle muscles or the neck's caving in, those intercostal muscles are caving in, they're breathing rapidly or deeply with their abdominal muscles, then this is a sign of not really good breathing. Breathing shouldn't put your muscles through a strain. It shouldn't be work to breathe. So just keep that in mind. So your diaphragm and intercostal muscles contract, pressure in the thoracic cavity decreases, Lungs fill with air. And this is considered the active part of respiratory cycle because something's actually happened to happen for it to take place. And then when we move on to our exhalation, the diaphragm and intercostal muscles relax. So everything's now relaxing, returning back to its normal area, if you will. The thoracic cavity returns to its normal shape and volume, and this is considered the passive portion of the respiratory cycle when we exhale, because everything's actually returning back to where it should be. So when we take a breath in, it's actually a process. We're having to actually move things. Our diaphragm's moving, our chest cavity is opening up, our lungs are expanding. But when we exhale, everything relaxes. That's why it is a relaxed motion or a passive motion. Function, sorry, let's see, the respiratory system. So the function is to provide body with oxygen and eliminate carbon dioxide. That's the whole point here of taking a breath. Ventilation and respiration are two separate, uh, interdependent functions of the respiratory system. So respiration is actually the exchange of oxygen and carbon monoxide in the alveoli and tissue. So don't confuse that with I'm counting my respirations. You're actually counting ventilations. Respiration takes place at the alveoli. Um, Provides oxygen to the cells and removes waste carbon dioxide. Diffusion, so passive process in which molecules move from an area of higher concentration to an area of lower concentration. So when we get into the respiratory chapter and we start breaking down the alveoli and oxygen diffusion and all that, it'll make more sense. But so we breathe in, our oxygen goes through our upper airway, lower airway, into our lungs, bronchi, bronchioles, down to our alveoli. Well, our alveoli are now holding carbon monoxide ready to leave. Oxygen comes in, it offboards into the alveoli. Well, now it's really crowded, so carbon monoxide leaves. So now we've got oxygen and we've got carbon dioxide. Carbon dioxide is going to leave the body on exhale, while oxygen is then moved into those capillary beds through diffusion, going to push on through into our capillary beds where it is pushed up into our heart, and now we cycle oxygenated rich blood from our heart. So we're taking things from high concentration, a really crowded area, and it is moving into a less crowded area and being used or being exhaled. Okay. Chemical control of the brain. So the brainstem controls breathing by monitoring carbon dioxide in the blood and spinal fluid. So we're not actually measuring our receptors are not measuring oxygen in our body. It's measuring the carbon monoxide or dioxide level. Excuse me. So primary reason for breathing is to lower carbon dioxide levels. This is called the hypoxic drive. It is what controls or measures the carbon dioxide and tells us we need to breathe. The nervous system control of breathing. This is the medulla. It initiates ventilation cycles. So it's stimulated by the carbon dioxide level. Once again, the pons have two areas to help augment respiratory, during emotional or stressful or physical stress. So our medulla and those pons are going to control how fast, how slow, how deep, how shallow we breathe. While back here, um, our brainstem is just our hypoxic drive is telling us to breathe, where this one is telling us at what rate and quality to breathe. Then we get into ventilation. This is the air movement into and out of the lungs. Requires chest rise and fall. It includes tidal volume, which the amount of air moved into and out of the lung during a single breath. And then residual volume, the gas that remains in the lung to keep the lung open. So if we exhale every bit of pressure out of our lungs are just going to collapse. So there's a little bit of residual air that stays in there that just keeps it open. Then we go to dead space. This is the portion of the respiratory system, the air that we breathe in that never reaches our alveoli. It never actually gets used. That is dead space. Respiratory rate times tidal volume will give you minute volume. So what are some of the characteristics of normal breathing? So we want a good rate and depth or quality. So that's 12 to 20 per minute for an adult. Regular rhythm and pattern of inhalation and exhalation. So we want it to be regular. We don't want 5 fast, deep breaths and then we hold our breath for 2 seconds. Or we don't want, it should be the exact same all the time. Um, Clear audible lung sounds on both sides of the chest so we can auscultate or listen to lung sounds, and it should sound the same. You should be able to hear some sort of air movement in and out of the lung, um, which we can get into lung sounds later. So regular rise and fall movement of both sides of the chest. So the chest should rise the same amount at the same time on both sides. They should move together. If they're not, then something's going on. Movement of the abdomen. It is natural for us to have some abdomen movement when we breathe. Excuse me. Oh. Okay, so inadequate breathing. So labored breathing, muscle retractions, pale, cyanotic, cool, damp skin, tripod position, or agonal gasp. Labored breathing is if you are working to breathe. If your patient looks like they are having to try to breathe, that is labored breathing. Muscle retractions, that what we talked about earlier, when you can actually watch the clavicle cave in, you can watch those ribs kind of cave in, or in between those ribs. Pale cyanotic, cool, damp skin. So we're pale in color. We're probably not perfusing well. We're cyanotic. So that's the bluing of the fingernail beds, lips. Um, that's lack of oxygen. Cool, damp skin. This is all signs of shock. And then tripod position, that's when we're sitting down, leaning forward with our hands on our legs, and you're probably sitting there kind of gasping. Agonal breathing, this or gasping, this is literally a gasp. This is just a, and then we're going to have complete silence, no movement for who knows how long exactly, and then we'll have another one. This is not considered regular breathing or acceptable breathing. The circulatory system, the anatomy, so it's a complex arrangement of connected tubes. So we've got arteries, arterioles, capillaries, venules, and veins. Two circuits. We have our systematic circuit, which carries the body. Then we have our pulmonary circulation, which is to the lungs and from the lungs. So we're going to start over here on the right. We've got our aortas that are dumping blood back from the body into the right atrium. It's pumped into the right ventricle. We then go up to our pulmonary arteries, where it is pumped to the lungs, where it is oxygenated at the alveoli. It comes back to our left atrium, down to our left ventricle, and then it goes back up to our aorta, which pushes out to the body with nice oxygenated blood. It cycles through, it feeds our cells and our tissues, comes back, and the process starts again. So the heart's actually a hollow muscular organ. It's the only cardiac muscle in the body. It's made up of specialized cardiac muscle. Works as two paired pumps, and the reason it says that is because both sides are actually pumping and running at the same time. So it's actually two pumps built into one. Each side is divided into atrium and ventricle. You have atrium right, atrium left, ventricle right, ventricle left. So circulation, the heart receives its blood from the aorta. The right side receives deoxygenated blood from the veins, and the left side receives oxygenated blood from the lungs. So the normal resting heart rate is 60 to 100 for an adult. Then we have what's called stroke volume. That's the amount of blood moved by one beat. We have cardiac output. That's the amount of blood moved in 1 minute. So if you take your heart rate times your stroke volume, you can get your cardiac output. And then real quick, talking about the electrical conduction system, specialized tissue capable of initiating and conducting electrical current cause, uh, causes smooth, coordinated contractions. And then contractions produce a pumping action. Just like we talked about, you apply electricity to a dead frog's leg, it jerks. You are doing the same thing to the heart. The heart is a muscle. When we apply electrical current to it, it reacts to that current by contracting. It pumps. So electricity hits it, and then let's go. Hits, let's go. And that is actually on a 12 lead or something. That is what you're seeing is you're seeing that electrical current causing that pump. Arteries carry blood from the heart to the body tissue. Aorta branches into your coronary arteries, carotid arteries, uh, hepatic artery, your renal, and your mesotonic artery. So arteries carry oxygen, poor blood to the lungs. Our arteries branch into smaller arteries that then into arterioles. Arterioles branch into series of increasingly small vessels until they connect to the capillaries. I'm not going to spend a whole lot of time. A pulse. A pulse is when the heart pumps, it pushes pressure on the arteries, and you can feel the pressure through within the artery, and that is a pulse. Your capillaries connect arterioles and venules. Fine-end division of arterial system allows contact between blood and cells. Veins return oxygen depleted blood to the heart. The superior vena cava carries blood returning from the head, neck, shoulders, and upper extremities. The inferior vena cava carries blood from the abdomen, pelvis, and lower extremities. Join at the atrium. So then we're going to talk the spleen. It's a solid organ located under the rib cage. It filters our blood and it is very susceptible to injury caused by blunt trauma. Can cause major problems if it is lacerated or ruptured. We have bad internal bleeding. Blood composition. So the plasma, or it's the clear liquid, and then you've got your red blood cells. You've got your white blood cells, which are your warriors. They go out and fight infection. Your red blood cells have your hemoglobin and carry your oxygen and carbon dioxide. And then your platelets, they cause coagulation or they will stick together and cause blockages. Or that's how you form like a scab, as your platelets stick together and form a blockage to try to protect from blood loss. Blood pressure, once again, this is the pressure exerted when the heart beats. So when the heart pumps, it fills our arteries under pressure. So when we take blood pressure, we are getting the highest point is the most pressure on that artery. And then at the lowest point, it's when everything is relaxed. The heart pumps, we get our high point. When the heart relaxes, we get our low point. We practice blood pressure in class and we will continue to do so. So your systolic is your top, your diastolic is your bottom. Automatically, like normal circulation in adults, so automatically adjust and controlled. Perfusion, circulation of blood to organs and tissue in adequate amounts to meet the needs of cells. And then hypoperfusion, inadequate blood supply to organs, tissues, and cells. So hypoperfusion is also shock when we are inadequately supplying blood and oxygen. Inadequate circulation, the system can adjust for small blood loss. Our vessels will constrict and slow things down. The heart pumps more rapidly to feed everything else. With a large loss, that adjustment fails. The patient goes into shock, and the mean arterial pressure can help detect shock. So what's the functions of our blood? It helps fight infection. It transports oxygen. It transports carbon dioxide. It can helps control our pH, transports waste and nutrients, and the clotting or coagulation. Let's see. Nervous system, control of the cardiovascular system is our sympathetic nervous system, and it's responsible for the fight or flight response. It sends commands to our adrenal glands, and it helps release that epinephrine or norepinephrine. Um, and these are excreted to stimulate the heart and blood vessels. So blood vessels have an alpha adrenergic receptor. The heart and lungs have a beta adrenergic receptor. The bioreceptors sense pressure in the blood vessels. The sympathetic and parasympathetic nervous system balance each other out. The nervous system is perhaps the most complex organ in the body. It's divided into two main portions, your central nervous system and your peripheral nervous system. So your central nervous system's the brain. It controls organs and bodies. The subdivisions are your cerebellum, your cerebrum, and your brainstem. Your cerebral spinal fluid cushions and protects the brain and spinal cord. Circulation in the head, oxygenated blood is supplied by the carotid artery. And then deoxygenated blood is drained by the internal and external jugular veins. Spinal cord, extension of the brain stem. So if you remember that brain stem ran right up in here on that picture a little bit ago, this is just an extension of it. It transmits messages between the brain and the body off of all of these little nerve endings that come out. Divided into two main portions, the somatic nervous system and the autonomic nervous system. The autonomic nervous system transmits signals from the brain to the voluntary muscles. So this is what the voluntary muscles are, what we kind of can control to move our arms, our legs, whatever. And then the anatomic or autonomic nervous system. This is involuntary actions. It splits into two areas, your sympathetic nervous system, so your fight and flight, or your parasympathetic nervous system, which slows the body. Two types of nerves within the peripheral nerve system. Your sensory nerves carry information from the body to the central nervous system, and your motor nerves carry information from the central nervous system to the muscles. A little bit on the skin. Two main layers, your epidermis and your dermis. Your subcutaneous tissue lies beneath the skin, and that's where your fat that insulates and serves as energy reserve. So a quick picture there, you've got your epidermis, it's just that very top layer. And then you've got your dermis, which is your deeper, there's more stuff in there like your nerve sensories, your sweat glands, hair follicles, stuff like that. The skin is the largest single organ in the body. Three major functions. It protects the body from the environment. It helps regulate body temperature, and it transmits information from the environment to the brain. Gastrointestinal system, your abdomen. The second major body cavity contains major organs and digestion and excretions, organized into four quadrants. So we have our upper right, upper left, lower right, lower left. And when we start doing our assessments, we'll get into assessing all four quadrants. It is good to kind of know what lies within each quadrant. So when we are assessing or we have a patient complaint, maybe it will help identify what the possible cause is. The digestive system is made up of the mouth, lip, cheeks, gums, tongue, salivatory glands, oropharynx, your esophagus, your stomach, your pancreas, your liver, your bile ducts, your small intestines, your large intestines, your appendix, and your rectum. So from mouth to rectum, it's everything that's considered in that digestive system. And then enzymes are made of food by the salivary glands, stomach, liver, pancreas, and small intestines. Food is converted into basic sugars, fatty acids, and amino acids, further processed by the liver, circulated via blood throughout the body. Elements of the lymphatic system are your spleen, lymph nodes, lymph vessels, thymus gland, and other components. Supports circulatory system and immune system. Lymph is a thin, straw-colored fluid that carries oxygen and nutrients to the cells and waste product away. Helps to rid the body of toxins and other harmful materials. The endocrine system, it's complex message, and it controls systems, integrates more body functions, hormones, and releases directly into the bloodstream. Epinephrine, norepinephrine, and insulin. Hang on a second. Sorry about that. Um, the brain controls and releases hormones. Excesses and deficiencies in hormones can cause diseases. Let's see. The urinary system controls and discharge of certain waste materials filtered from the body by the kidneys. Controls fluid balance in the body. It filters and eliminates waste, and it controls pH balance. Your urinary system is made up of your kidneys, I never can say that word. Um, yeah. And then your urinary bladder. I cannot pronounce that word to save my life. Ureters. How's that? Um, controls reproductive process. Oh, sorry, the genitalia system. It controls your reproductive process. Male system consists of testes, your epid, once again, don't know half these words. Your prostate gland, your seminal vasculars, and your penis. The female system consists of ovaries, fallopian tubes, uterus, cervix, and vagina, which we will kind of get more into the female side than we do the males because of our OB chapter. We'll go more into depth into the fallopian tubes and uterus and all that later. So life support chain, all cells in the body require oxygen, nutrition, and removal of waste. The circulatory system is a carrier of these supplies and waste. If interference occurs, cells become damaged or can and will die. If cells die, then we have tissue death, and then it goes downhill from there. Um, a lot of this focuses on our brain. We have got to constantly be feeding the brain with oxygen and nutrition. And when we lack for a very small amount of time, we are in big trouble. Cells use oxygen to turn nutrients into chemical energy through metabolism. Aerobic metabolism uses oxygen. Cell switch from to anaerobic metabolism with oxygen when oxygen is limited. So I'm not going to go into the whole Krebs cycle, but with oxygen, we produce a very large number of this energy. It's called ATP. And without oxygen, we still produce ATP, but it is a very low number. So it's a huge difference with and without oxygen, how much energy or ATP we can produce. Movement of oxygen, waste, and nutrition occurs by diffusion. pH is critical to diffusion. The body depends on a large amount of energy to maintain normal pH. Pathophysiology is the study of functions changing that occurs when the body reacts to a disease. Respiratory compromise is an inability of the body to move gas effectively, so we get hypoxia and we get hypercarbia. Cardia there. Um, Factors that impair ventilation, blocked airway. We're not able to breathe. Impairment of the muscle of the breathing. So we have a ruptured diaphragm, or we have something crushing us and we are unable to expand to take a breath. Airway obstructed, like asthma, so we have swelling of our airways, or maybe pneumonia, where we have just junk in there and we can't get the right amount of air, the needed amount of oxygen to pass all the way to those alveoli for diffusion. Change in atmosphere, high altitudes, impaired movement of gas across the cell membrane, which that's kind of what I was talking about with the diffusion, or if we get a lot of fluid or mucus in our lungs and it surrounds those alveoli, that oxygen can't diffuse into the alveoli. Carbon monoxide cannot diffuse out of it, and now we've got that imbalance going. You've got the VQ ratio. How much gas is being moved effectively through the lung? How much blood is flowing around the alveoli in those capillary beds where that perfusion needs to take place? If any of these aren't working well, then we're going to have trouble. You're going to have an abnormal breathing pattern, an abnormal perfusion, or we might even start seeing signs of shock. The heart is going to speed up, our respiratory rate. There are all kinds of things going to happen if we're not perfusing correctly. Effects of the respiratory compromise on the body. So oxygen levels fall and carbon dioxide levels rise. Remember, our body measured our carbon dioxide level, not our oxygen level. Um, Respiratory rate increases, the blood becomes more acidic. The brain sends commands to the body to breathe. Cells move from anaerobic to an anaerobic metabolism. So now we're lacking oxygen. We're not breathing well. Our heart rate um, is going to speed up. Our respiratory rate increases, but we're still not getting that perfusion. So we're producing less energy because we're now in anaerobic metabolism. Lack of oxygen, we go into anaerobic. Shock, which we're going to hit shock in a different chapter, but it occurs when organs and tissues do not receive enough oxygen. Impaired oxygen delivery causes cellular hypoxia, so lack of oxygen. Um, Characterized into several types depending on the cause. There are 6 or 7 main types of shock that we will go over in a later date. Um, Effects of shock on the body, the level of oxygen supply to the tissue falls. Cells engage in anaerobic metabolism, so less energy being produced. Um, Several metabolic acidosis ensues. Barrier receptors initiate and release epinephrine or norepinephrine. The heart rate will increase, trying to make up the difference, and then your interstellar fluids move into the capillaries. A result in the inability to properly use oxygen and glucose at a cellular level. Cells create energy through anaerobic metabolism, can cause the metabolic acidosis. Brain cells cannot use alternative fuels, and this is where I was talking earlier about the brain. Cellular injury may become irreversible. So our brain needs a constant supply of oxygen-rich blood, um, and we need to be metabolizing, making that ATP at a high number, which burns a lot of energy to do that. Um, and I don't remember the exact number. It's like 4 to 6 minutes or something like that. We start getting brain damage, and it can become irreversible. So that's why respiratory and cardiac go hand in hand, and they are so important. So we did this in class, so I'm not going to redo. We're not going to redo the review, but I threw this together real quick for you guys. If you want to go back and watch it, you can. I know you all were in class, except for one student, but um, if you have questions on this, there's a whole lot here that we could go really deep into, but we're also going to cover it in later chapters. That's why I didn't spend as much time on it. So please do your quizzes, do your practice test, write down your questions, call me, email me, text me, whatever. Um, and we will go over any questions you have before you actually test on chapter 6. So thanks for putting up with me, guys, and I will see you on the next one.